Hello, Precure community. I'm Sonya. I'm a registered nurse with the Precure team. And it goes without saying that the last month has been a whirlwind for all of us. In New Zealand, we've been in lockdown for 1 week. And in Australia, we are facing different restrictions and lockdowns throughout the country. And it really has been a bird's eye view of the human condition and human resilience, and just watching as we walk on the streets and our coming out of our lockdown daily, and looking on the World Wide Web at the amazing adaptability of humans, of the kindness, of the care, and of the ingenuity that we're seeing in people's back gardens. And I think it's really, really important here to acknowledge some of the hardships that people out there are having, some of the grief that they're facing, and people losing their jobs, and all sorts of things happening out there. And that this sense of community that we're seeing, this human resilience, will need to go on for a long time after this. So heartening to see, and there is a new norm out there for us all. We're in different times where we're navigating different waters, and I think that it's been really, really interesting going in to COVID-19 lockdown for New Zealanders. A week ago, or more than a week ago, we were running around buying things, getting ourselves set up to lock down, and we had our priorities, we knew what we needed, and we thought about how this would look for each of our bubbles. And I'm really interested to know, now that we're in lockdown, what are the things that we're using and needing that make us healthy, help us entertain ourselves, and what are the things that we bought that we actually need, and what are the things that we already had in our homes that actually have become quite useful. And if we could turn back time, if we could get in a time machine and go back that couple of weeks, going back into lockdown, how would have our priorities changed around what we need? And do we need half of that stuff? Is this focus on health? Is it on entertainment? Really, really important questions. And I think, once we've been in lockdown for a month or more, whatever it takes for this virus to pass, how are those priorities going to change, and how is that going to better us as human race? I think the reflection for me is within our own health bubbles, our immediate families and communities around us, and our perceptions of what health is. And I think, everybody's health perception is different according to their culture, to their experiences in childhood, and to some of the experiences they've had with hospitals and health professionals to date. And it's really interesting in my own practice as a critical care nurse specialist. I often assess patients and I talk to them about what's going on for them, and they'll say to me, "No, I'm pretty healthy and things are good." They've often deteriorated, and I have a look in their health records, and there is a list of what we call comorbidities or chronic illnesses, such as things like high blood pressure, hypertension that may be managed with medication, pre-diabetes, and a list of other things. And yet they consider themselves healthy. And I guess this is the crux of what I wanted to talk about tonight, is in modern day times, what is health and what do we believe health is? And certainly there is an epidemic of chronic health out there already that we in the hospital systems are dealing with. Now that we're faced with this virus, with COVID-19, and we're all thinking about our health a little bit more deeply, have our priorities changed around this? And certainly, have we had that chance to take a deeper look individually as, am I healthy? What do I need to do to become healthy? It really is about having that courageous look here. And I think those priorities that many of us have had a chance to think about in lockdown are the simple things. The simple things such as eating whole, unprocessed food. It is, granted, very hard to do in this day and age, but it is clear that high sugar intake damages cells. And so let's get back to basics and have that real unprocessed food. Are we prioritising our life to spend time in the green and blue areas? Are we going out for walks and walking by the lake and the water and getting out into the greenery and listening to the birds and getting that really important sunlight? And it's been, I have to say, the lockdown, I've seen so many people that live on my street that are out walking. And I think this is great. This is a great change in priority. Sleep. Sleep is something that a lot of us, and I'm putting my hand up here, do not prioritise. So, you know, can we create opportunities for 8 hours good sleep per night? Are we socially connecting? Certainly for many, social connections changed over the last little while. Our priorities for those people and friends and family close to us has changed. So I guess really what I'm saying here is, let's be proactive. Let's use this opportunity to really think about what are the priorities around my health, and going into this uncertain future, being brave enough to think, am I really healthy and do I need to make change? And for me personally, I'm currently doing a course in coaching. And something that's been really, really useful in the philosophy of this coaching and working alongside clients to collaborate with them to reach their health goals is thinking about working on what is positive and what is possible with those clients, and really delving into deeply what are their health perceptions and what can work for them to make a better quality of life. And I think it's for them about being courageous, about being vulnerable and saying, really, where am I at? And a really, I think, powerful question for all of us to ask ourselves and our families is, what positive difference will better health make for me? And, you know, I know for me, when I started Precure, when I started with Precure and preventative medicine, I thought I was really healthy. But I have learnt over the last few years that actually it's those simple things done well that can make me have better health and have a better quality of life. So ask yourself, what positive difference would better health make to me and my close family members? And have that talk. Let's be proactive. I think to really put this in a nutshell, I looked at the words of Charlie Chaplin, who said, you will never find a rainbow if you're looking down. And for me, coaching, I have learned, is all about the here and now, looking at what's happening now and looking about moving forward positively into the future. So I encourage you all to really think hard about your health and your priorities around your health and move towards what is positive and what is possible. I'd just like to also say that I found it really interesting looking globally at places like China and Italy and now the US, parts of Europe, at this health systems that are on their knees. And for myself, I've been in the health system nearly 30 years, and I found that anecdotally for me, I really, truly, honestly thought it is on its knees already. I see staff shortages. I see people really struggling with their chronic health. I'm seeing younger and younger people really sick, and we're getting to the stage where we can't reverse their illness. I'm seeing a global widening pandemic of chronic illness. So I think we need to rethink what is health, and do we accept living on multiple medications, and is that a quality of life? There's big questions here to be asked. And I think part of the coaching arena with that and working with people to prevent this chronicity of health is making ourselves and our community accountable to that, accountable to being proactive with their health. Now, secondly, I just wanted to talk a little bit about COVID-19 from the view of a 70-year-old. And to do that, I talked to my parents, who are both in their mid-70s, about how it was affecting them and what are their thoughts on COVID-19. And I was absolutely blown away. They sent me pages of stuff that they'd written down, and I think even having the opportunity to talk about that was really great for them. And I guess for me, it's made me more empathetic to the community that we've locked down in New Zealand and in other countries, and making sure their voice is heard, because it's a really, really important one. So what I've done is I've collated that 4-page document, and I really wanted to take the opportunity to read that to you, because I think there's a lot of lessons in here. So, our generation has not had a threat like this we face, apart from the Vietnam War. It makes us realise how other generations before us have felt, like the First World War, when returning soldiers brought the Spanish flu home. We feel threatened by the fact that we cannot do lots of normal day life things. We feel restricted that we cannot see and help our very sick friend. We feel useless to do anything about it. We miss our grandchildren. We worry for our family on the front line. We worry about others' finances. For us, this is already how we live financially. We are having to negotiate how we get on with each other. We must trust ourselves to make the right decisions. We know it's important to be updated with the news in the morning and at night, but not to listen to it all day, as it does not help anyone mentally. We talk about what if. We have a lot to feel positive about. We are fit, so we can continue to exercise without others. We, now in isolation, have more contact with extended family members and friends and realise this is how it should be. People that when we see when walking and have done so for a long time now say hello. This feels good. It is time to reflect on our values and to realise how important family and friends are. We know that health is the most important thing we have, and this virus for us has emphasised that. We know our life experiences hold us strong. We are lucky. And for me, that really embodies what is positive and what is possible.